Hi, so my name is Mike Haney. I'm a student pharmacist at ISU, and I'm here to counsel you today. So, can I get your name and your date of birth?
My name is Casey Easton, and I was born March 8th, 1999.
Okay. And do you have time to discuss the medication today?
Yes.
Okay, so are you taking any medications right now?
Just daily vitamin, but that's it.
Okay. And are you allergic to anything at all?
No.
Okay. So, what seems to be your problem today?
I have a slight pain on the right side of my forehead that has been bugging me, and I have a bit of a drinking problem, so I don't know what to take so that I don't get hooked on it, because that's my problem, hooking on medication.
Okay. Well, I think it's very important that you told me that because alcoholism can cause a problem and can cause you to get addicted to some medications. But I think in this case, the best case medication for you would be Tylenol, which we have here in the pharmacy. Its only active ingredient is acetaminophen. It does very well at relieving headaches, but you will have to be careful about taking it while drinking. You want to make sure that you are not drinking and taking it at the same time. And that's why these counseling sessions are so important, so we can explain stuff like this to you so you don't make a mistake. So what do you know about Tylenol? Do you know anything about it, or have you never seen it before?
No, I don't know anything. Never heard of it.
Okay, so straight up, the brand name is Tylenol. The generic name, acetaminophen. It's an extra strength pain reliever. Its dosage is 500 milligrams, I believe, in 2 tablets. And yeah, 2 tablets is 500 milligrams. Dosage form is oral, and this is what it looks like again, just so you know. And then the uses for the medication are listed here on the box, so if you forget, you can read them again. But mainly any kind of pain, any kind of angina, which also means pain. It's good for headaches. It should be good at relieving your headache, especially since it's only been lasting you about an hour and it hasn't been chronic.
Right.
Just remember, you take this orally. You want to take it with food. I believe it tells you right here on the side, do not take this with any other prescription drug. And ask your doctor before taking if you have liver disease. That's why I said alcoholism can affect it. Alcoholism can affect your liver. You want to take this with a meal. If you don't take it with a meal, it could cause your stomach to be upset, maybe a little diarrhea. If you miss a dose, if it's close to your next dose, you just want to take your next dose. If you miss it by like 10-15 minutes, then you just want to take the dose right then. And you want to be taking this as long as your headaches are lasting. If your headaches last for 2-3 weeks, then you're going to want to go see your doctor and ask him if you should use something else. But for now, you want to try Tylenol for at least 2 or 3 weeks. See if it relieves your headaches. If it does, then you can discontinue the Tylenol because you no longer need it.
Right.
Yeah, and then just make sure you remember to take it with food so you don't get that upset stomach.
Okay.
And then so this drug should relieve you of your headaches. It should relieve you of your pain. You said it was a 6 out of 10, I believe. So it's not unbearable. It should at least bring your pain down to a 1, if not a 0, hopefully. And it should relieve that pain without you getting hooked. Tylenol is a very hard drug to get hooked on. It's just going to relieve your pain. It doesn't give you a high. It doesn't make you feel drunk like alcohol. It's just there to relieve your pain. So, I mean, if you really like to relieve your pain, you might get hooked on it, but I think you should be okay in taking this. I don't think you're going to get addicted to it. And then, the major thing I would say is don't take this drug if you're taking other drugs, which you said you're not, so you're fine.
Right.
So you're good to go with that. And then for yourself, for monitoring, you're going to want to take more Tylenol if you still have a headache. So if you take a dose, your headache goes away, but then it comes back 30 minutes later, then you're going to want to wait 4 or 5 hours and take another dose. And just take doses until it goes away. Or I believe you don't want to exceed more than 4,000 milligrams a day. So that means you don't want to exceed more than 4 doses.
Okay.
Or, 8 doses.
Okay.
So that's 8 doses, 2 hours in between each dose. You don't want to be taking doses too often, or it could be toxic.
Okay.
So every 2 hours, see how you feel after the 2 hours after the first dose. If you need more, take more. If you don't, then don't. And then, the only time you're going to need to go to your provider for a follow-up is if your headache persists and this does not take care of your headache. And so now, tell me a little bit about Tylenol. Tell me what you know about Tylenol.
It's supposed to relieve any sort of pain or angina, as you mentioned, and that I should follow what is recommended according to what's written on the box, and to not exceed anything beyond that because, as you just mentioned, it could be fatal.
Okay, and what about how do you take it? Is it oral, injectable?
Yeah, I'm supposed to take it with food. You
Okay.
said, or with water.
Okay, and do you remember what the dosage amount is?
I think 500 milligrams.
Yes, sir. Yes, it is. And so you just want to remember, don't take more than 8 of those in one day. And if you're taking at least 2-hour breaks in between your doses, then you should never exceed that much because you're also going to be sleeping. So do you have any questions or concerns about this?
Nope.
Okay, and well, thank you for your time. And if you need to be counseled again, I'm here. I'm always willing to help. And here's your time.
Thank you, sir.
Thank you.